Hello, my name is Kelly Briggs and I'm a Maryville University nurse practitioner student, and this is my neurological assessment demonstration video. This is Kevin. He's a 36-year-old male. He's going to be my patient for the day. The first thing that you want to assess on the patient is the cranial nerves. Cranial nerve number 1 is assessed by having the patient occlude one nostril with their eyes closed, and you want to place either toothpaste or coffee to see if the patient can identify the smell. The second cranial nerve is assessed by use of the Rosenbaum pocket card that assesses their near vision, while the Snellen chart is utilized to assess the patient's distant vision. The next test that you want to perform is you want to assess the patient's cranial nerves 3, 4, and 6, which is the oculomotor, trochlear, and abducens nerve. You do this by testing the patient's ability to follow your pen light through the 6 cardinal fields of gaze, noting that there is no nystagmus present, and we'll note that those cranial nerves are intact. The next test that you want to perform is you want to assess cranial nerve number 5, which is the trigeminal nerve, having the patient clench their teeth. All right, great. The next thing you want to do is have the patient close their eyes and identify if they can feel what part of the face that you're touching the Q-tip with.
Left cheek, chin, right cheek.
All right, great. And cranial nerve number 5 is intact. The next thing you want to do is you want to assess cranial nerve number 7, which is the facial nerve, by having the patient smile, frown, and close their eyes tightly. Great. And we know that cranial nerve number 7 is intact. The next thing we want to assess is cranial nerve number 8, which is the acoustic nerve. Have the patient occlude their right ear with their finger, and I'm going to whisper a series of 3 letters and numbers, and I would like for you to repeat them back to me.
H69.
Great. All right, the next test that we want to perform is the Weber test. Kevin, I'm going to strike this tuning fork, and I want you to tell me if you can hear equally out of both ears. Are you able? All right, great. Which is a positive test, which is a normal and expected finding. The next thing that we want to do is we want to perform a Rhine test on the patient. I'm going to strike this tuning fork and place it behind your ear when you can no longer hear. I'm going to place it in front of your ear, and I want you to let me know when you can no longer hear that, okay? And that was a 2-to-1 ratio, which is a normal unexpected finding. The next thing that we want to do is we want to assess cranial nerve number 9 and 10. The first thing we want to do is we want to have the patient, if you could stick your tongue out for me and say ah.
Ah.
All right, great. And his uvula had a slight rise and it remained midline, which lets us know that cranial nerve number 9 is intact. Cranial nerve number 10 is assessed by eliciting a gag reflex, and a positive gag reflex is a normal and expected finding. The next thing that we want to do is we want to assess cranial nerve number 11, which is the spinal accessory. Kevin, I'm going to press on your shoulders, and I want you to shrug them for me. All right, he was able to shrug his shoulders, which is a normal and expected finding. If you could turn and look to the right and then try to resist, all right, which is also a normal and expected finding. The last cranial nerve, number 12, we assess that by having the patient stick their tongue out and move their tongue side to side. All right, great. Noting that cranial nerve number 12 is intact. All right, the next test that we want to do is we want to assess the patient's cerebellar function by having the patient stand up, place your hands by your side, and close your eyes, noting that his posture is upright, there's no swaying or staggering present, which is also a normal and expected finding. All right, Kevin, open your eyes for me, and if you could go over there and take about 5 or 6 steps towards me in a heel-to-toe fashion. All right, noting that there's no ataxia present. The patient has an upright gait with a normal posture and is nice and steady, which is also a normal and expected finding. If you could have a seat for me, Kevin. The next thing that we want to do is we want to test the patient's proprioception by having the patient close his eyes, and I want you to touch your pointer finger to your nose on both sides. All right, great. And we want to note that the patient was able to do that in a nice fashion The next thing that we want to do is, Kevin, if you could place your hands on your knees, and I want you to flip them over again and again and in a faster. Okay, great. And the next thing that we want to do is we also want to assess his rapid rhythmic movement and his fine motor skills by having the patient take their thumb and touch it to each finger back and forth faster and faster. And he's able to do that, and that is a normal and expected finding. All right, the next thing that we want to do is we want to test, we've already performed the Romberg test on the patient, which is negative and a normal and expected finding. The next thing that we want to test is for his sensory perception of pain or touch. Kevin, if you could please close your eyes for me and tell me where I'm touching you.
Left cheek.
All right.
Right hand.
All right, great. And his sensory perception is intact. The next thing that we want to do is we want to perform a test to test for the patient's vibratory sensation. Kevin, if you could close your eyes, and I'm going to strike the tuning fork and place it on one of his bony prominences. And I want you to tell me where I'm touching you.
My right middle finger.
Great. And then again.
My left great toe.
All right, great. Which is also a normal and expected finding. The next thing that we want to do is we want to test the patient's ability to identify positioning. Kevin, I'm going to lift one of your fingers, and I would like for you to tell me which one with your eyes closed. All right. Can you tell me which finger?
My left middle finger.
All right. And then can you tell me which toe?
My right great toe.
All right, great. That's also a normal and expected finding. The next thing that we want to do is we want to place a familiar object in the patient's hand with his eyes closed. If you could open your hand for me, and you want to note if the patient can identify the object accurately.
Coin quarter.
Yes, which is also a normal and expected finding. The next test that we want to perform on the patient is a 2-point discrimination test. If you could please open your hand for me the other way. All right, and I'm going to touch him using a paper clip. Can you tell me if it's 1 or 2 points?
2.
All right, and then again.
1.
All right, great, which is also a normal and expected finding. The next thing that we want to do is we want to assess the patient for graphesthesia. If you could open your hand for me, Kevin, and close your eyes, and I'm going to draw a letter or a number on the palm of your hand, and I would like for you to identify which one it is.
8.
All right, great. That's also a normal and expected finding. The next thing that we want to do is we want to assess the patient's deep tendon reflexes. The first test that we're going to perform is on the patient's tricep. You want to strike it with the point of your hammer, noting that there is a positive reflex on the tricep. The next thing you want to do is on the bicep, noting that there is a positive reflex on the bicep. The next test that we want to perform is going to be the brachioradialis reflexes, noting that there is a positive reflex on the patient. The next test that we want to perform, if you could lay back for me, Kevin, is we want to check his abdominal reflexes, and we want to glide it on each quadrant, noting that we elicit the abdominal reflexes. And there's positive reflexes, which is also a normal and expected finding. Kevin, if you could pull your pants up for me a little bit. The next test that we want to perform, if you could sit back a little, we want to strike and test his patellar reflexes. Positive reflexes is a normal and expected finding. The next thing we want to do is we want to assess the patient's Achilles, noting that he has positive reflexes, which is also a normal and expected finding. The next thing that we want to do, we're not going to perform this test. You would assess the cremasteric reflexes by striking or gliding the inner thigh and noting if there's a lift of the scrotum or testicles on the same side of the thigh, which would also be a normal and expected finding. The next thing that we want to do is, Kevin, if you could lay all the way back for me. You want to test their plantar reflexes, by starting on the lateral surface of the patient's foot, moving in medially on the ball of the foot, noting that the toes curl in, which is a normal and expected finding, which is also considered Babinski negative. The final test that you want to perform on a patient is you want to check for ankle clonus. Holding their leg, you want to dorsiflex and plantar flex the foot, noting that this is a normal and expected finding. An abnormal finding would be an uncontrollable plantar flexion of the foot, which could indicate a neurological abnormality. And that is the end of my video. Thank you for watching.